Starting Saturday, health insurance companies will have to pay for at-home COVID-19 tests you buy in the stores. Insurance company will have to pay for 8 tests a month per person. You can either get the cost covered up front or you can file a claim for reimbursement. The department says a doctor's order, prescription, or office visit will not be required. You also won't have to pay deductibles or co-pays to access those tests. All right, joining us now, Dr. Ali Raja. He is the Executive Vice Chair of Emergency Medicine at MGH in my city of Boston. He's also a professor at Harvard Medical School as well. Dr. Raja, it's a pleasure to have you. I am speechless. We're now hitting a million, 1.3 new COVID cases. What are you seeing?
Shani, it is everywhere. During my shifts this week and last week, I'm admitting patients with heart attacks and with strokes and after car accidents and gunshot injuries, and they're testing positive for COVID, even though they didn't have any symptoms. It is everywhere right now. Even the patients who don't seem like they have COVID when they're coming in, we find out they have it when we test them.
Dr. Raja, how's that make your job harder?
It makes it pretty hard for a couple of reasons. I think, number one, the thing is that when we admit a patient to the hospital, regardless of whether or not they come in with COVID symptoms, if they have COVID, it means that they need to be in a special room. It means that we have to don all of our PPE before we go in that room, use an N95 and all the stuff when we go in, even when we're taking a food tray or when we're doing some sort of a procedure on them. But then also the fact is right now, Tashani, it's really hard to staff hospitals in this country. We've got nurses, environmental services personnel, doctors, PAs, everybody getting sick and getting symptoms and having to stay out of work. And every time another patient comes in, we're honored and happy to take care of them. But it also means it puts us at a little bit more risk.
Yeah, well, talk to me more about that staffing shortage that you're experiencing. I mean, is the hospital now at the point where you're just telling all staff, come to work, go home, just so they can minimize their risk?
You know, there's not really a mandate to do that, obviously, but that's what we're all doing, right? All the social events have all been canceled. We used to have these great sort of team, building events. And they were always outdoors, but now it's just too cold to have those and we can't do them inside. And so we're just not seeing each other outside of work. And what that does, especially in a place like the emergency room where you really need the team, the only place we see each other is at work. The only part of our faces that we see is like this. We don't get to know the new team members. It's really hard on morale for everybody right now.
Yeah, and speaking of that morale, how are you all handling the CDC guidelines? They seem to change every week.
They do, and it's tough because, I get where the CDC is coming from. The evidence is changing as we're navigating this pandemic. But, we have a system where when patients come in and get tested in the emergency department, if they're healthy and we can send them home and their oxygen saturation is good, we send them home and then we call them back later with test results. And what happens is we call them back and we give them the recommendations that we're supposed to from the CDC. And they have so many honestly well-intentioned questions, good questions, like the 5-day isolation period. If we tell them, isolate for 5 days, and then at the end of that, take a test if you have it. And if that test is positive, isolate for another 5 days. Their very valid question is, well, isn't that a disincentive to being tested? If at the end of 5 days I'm feeling fine and don't have any symptoms, aren't I better off in terms of being able to go to my job and being able to not isolate away from my family, being able to go to the grocery store, if I just don't take a test? Because if I take a test, my life is just impacted for another 5 days. The new guidelines, if they do come out with mask change guidelines, that's going to go in the face of everything we've been recommending for the past many months. And it's probably the right thing to do. But at the end, it's just going to erode confidence in what we've been telling patients for many months.
Yeah. I want to know how staff is also handling the 10 days originally for isolation cut down to 5. How are they responding to that?
Well, I'll tell you, it's a mixed message all around. The fact is that it was really hard to staff, even harder to staff when we had a full 10 days. So at 5 days, if we're feeling fine, our health system actually mandates that we get a test. But if that test is negative, then we can come back and actually That part of it staff are fine with because nobody wants to be home feeling just fine and having your coworkers work twice as hard trying to fill your shift. Um, but what we don't want is we don't want people coming back early with symptoms, and sometimes we run the risk of that as well, and that can frustrate people.
Yeah, considering how tapped out I'm sure you are and your staff members and just everyone in the healthcare field, I know I'm tapped out.
Yeah.
What do you think about hospitals recommending people who test positive come back to work positive, but they just work with positive patients? Would you recommend that?
I think that's really tough, Shani. I get why health systems and why they just want to take care of their patients, and so they need staff to do that. But the fact of the matter is, if you're still positive, testing positive, and could potentially spread it to others, that just isn't a very safe practice. And quite honestly, it sends the wrong message to the staff because what you're telling them is, for better or for worse, you're kind of expendable, right? Like you're
Exactly.
testing positive, keep coming back to work, keep seeing patients, keep putting yourself at risk and potentially others at risk, and that's just the wrong message.
Yeah. Dr. Ali Raja, always a pleasure. Thanks for stopping by to talk with us, sir. And best of
Thanks for
luck.
having me.
Tough times out there with this Omicron. All right, Chicago schools will reopen